Hi, everyone. I wanted to go over doing the labs so quickly that we can clear out all the normal labs or stuff that we appropriately covered. I'm using this screen here. It has 3 test labs. They're not necessarily a urine or CBC, but it gives you the gist. So you come in the morning and this whole page is full, next page is full. You're going to start obviously on the first one. And let's just say that this is a urine. PHR now is going to be integrated, so hopefully all the stuff will show up here. But if it's not, always remember you can come over here to reports as well. You can come over to this side and click the paperclip and see the report. So those are the spots you would look. So let's say this was a urine. And I looked at the result and it said that it had greater than 100,000 E. coli. But that's all I have. I don't have a sensitivity. So we're going to want to preliminary positive here. A quick way to do this is come over here. I click that add notes, click this button here, and you're going to do culture in progress. Follow the plan of care, wait for the final results. Going to hit OK. Hit OK, come over here, publish this, and then hit reviewed, all right? Now, this same patient, and this happens on my shift, 3 o'clock, I see this back in my queue again because I've hit reviewed and it's off, and now it actually shows me the sensitivity. So I look at the sensitivity, patients on Macrobid, I see what's available there. I come over here to my progress note, I look down to see what my other provider gave. Oh, looks like they gave Macrobid. Then I look at my culture. It's sensitive to Macrobid. So then I'm going to come over here and I'm going to hit positive. I'm going to go back to my add notes. The patient's appropriately covered, so I don't have to have anybody really call them. And I'm going to hit this. Continue. Culture is positive. Sensitivity indicates that you should continue your current antibiotic. I hit OK, hit OK. And then I hit reviewed. So that will then get this off the screen. Now, some people, if you're looking at these and you're going through them and you hit results or you hit something, and sometimes if you come over here and you hit next, there's a chance that this may cause a review or have it reviewed potentially. So just make sure that you're watching if you hit reviewed or you don't hit reviewed. But there should be special notes. And what's really helpful is during the college season now, if you have these people with no immunity, this is a great one. Patient does not have immunity. You don't have to sit and type all this stuff because as a provider, your name will show up and it shows that you had that. Obviously, if somebody's going to need a booster, again, this is when you're going to want to assign this to the MA that's in the office that's calling back patients to tell them, hey, you need to come back in for your shot. You can release this to the portal so the patient can get, but don't hit reviewed. Don't hit reviewed, but you can, if they need their booster, at least hit publish to the web and your little note will be in there, and maybe your MA doesn't get to it, but the patient will get an email that says, hey, you're going to need an extra shot or whatever the case might be, or hey, your antibiotics are going to need to be changed and so forth. Always remember, anything on the left, the patient can read if they pull up their portal. So don't put anything that should not be seen by the patient in here. If you have a private note, put it on this side. It's internal. No one's going to see that. I hope you're having a great day, and any questions, please send me an email.